So, hello and welcome to this live session that we are doing today on the do's and don'ts after cataract surgery. So, this is something which we get a lot of questions asked about. There are a lot of doubts, there are a lot of misconceptions, a lot of beliefs which may or may not be accurate. So, this is something we felt is important to discuss, and we'll do that today. So we are discussing it in terms of the questions that we are commonly asked. If you have any questions, you can also leave your questions in the comments box, and we'll be happy to answer those. So let's start. So can we have the first question? Yeah. So the first question that we have is, what are the essential do's and don'ts to follow immediately after cataract surgery? So the most important things that you should do is to avoid taking a bath from above your face level. So you should be taking a bath from below your face level for about a week. And that is because we don't want any dust and water going into the eye. Also important that you don't touch your eyes, don't rub your eyes, again, because we don't want any source of infection going into the eye. It's important that you follow up with your treating surgeon the next day and then subsequent follow-ups as have been advised to you. So, like I said, probably the most important thing is avoid letting dust and water enter your eyes soon after cataract surgery. So the next question that we've been asked by Ashish is, can you explain the recommended post-operative care routine for someone who has recently undergone cataract surgery? Correct. So the most important things to know post-operatively is that you should avoid dust and water going into the eyes. And I'm stressing this again and again because this is what really matters. Other than that, there are a lot of drops that are given to you, about 4 to 5 drops. This includes a steroid drop to cut down the reaction after surgery. This includes an antibiotic. This includes other anti-inflammatory drops. This also includes some drops to reduce your pressures. So each drop has a different dosage regimen. So it's important for you to understand very well which drop has to be used how many times and for how long. The other important thing for you to know is, when do you have to follow up next with your treating surgeon. So the next day is important, and subsequently the remaining days are explained to you by your treating surgeon again. Okay, so the next important question is, what activities should be avoided in the first few days following cataract surgery and why? Okay, so like I said again, dust and water should be avoided. We do not want any dust and water entering the eye for the first few days, ideally at least a week after surgery. So if you can wear some protective glasses, whether it is dark glasses or normal protective glasses, at least for a week, when you go out anywhere where there is a possibility of dust and water entering the eye. You don't necessarily have to wear protective glasses at all times when you're inside your house. On the day of surgery, we would like you to wear protective glasses even at home. But after that, you do not necessarily need to wear protective glasses at home. But if you go out anywhere where there is any possibility of dust entering the eye, you should wear your protective glasses at least for a week. For a week, try and take a bath from below your face level and avoid water getting into the eye. Then, what we are often commonly asked is, are there any dietary restrictions? Is there anything that we cannot eat? So, you can eat anything you want. There are no dietary restrictions when it comes to cataract surgery. So, this is something that is important to know. And what we are also asked is there any particular posture that you should be sleeping in? Is it okay to sleep tilting towards your right or left? Yes, it is absolutely fine. If there is any specific rare scenario for a particular patient where we do not advise change in positions while sleeping, we would specifically inform them. But in most cases, there is no restriction as to which position you sleep in. Okay. So Ria wants to know, are there specific medications or eye drops that patients should use or avoid after cataract surgery? Okay, so there are specific eye drops that are advised to you after cataract surgery. This, like I said, includes a steroid drop, an antibiotic drop to prevent infections, an anti-inflammatory drop usually a lubricant drop to prevent dryness, and some other drops that may be advised to you in your particular case. So it's important to follow the exact schedule that has been given to you and use these drops exactly as advised. Apart from that, if you have any other conditions for which you are using drops, say for example somebody has glaucoma, those drops should be continued as well. If you have any other systemic conditions like diabetes, hypertension, and are on medication for that, then those medications have to be continued as well. So if you have any doubts, discuss with your treating surgeon, but medications for your other conditions should be continued after cataract surgery as well, and the drops specific to cataract surgery should be followed as per the schedule. Okay. So the next question is from Rahul, who wants to know how long should patients refrain from driving or engaging in strenuous physical activities after cataract surgery. So my recommendation for this is about a week. So it takes you about a week for you to get comfortable from your new optical system that you have now. Your old lens has been replaced with a new artificial lens. Initially you can have a little bit of sensitivity to light, you can have some discomfort, so it takes some time for you to get comfortable with your new optical system that you have, which is why about a week is adequate time for you to get adapted well, and then you can slowly start driving. Don't suddenly start driving for many hours in a day or start driving straight on the highways. So start slowly, but in a week you can start. And as far as strenuous physical activities are concerned, even those can be started after about a week in most cases, but I would suggest that you discuss it with your treating surgeon before you start them. The next question is from Nihari, and the question is, can you provide insights into the proper way to administer prescribed eye drop after cataract surgery? Great. So that's a very good question, and I think this is a good idea that for us to share some videos and information in our subsequent reels or content that we share as well. So just to demonstrate, I mean, you should not be rubbing your cornea or the white part of your eye when you're instilling a drop. You should pull this part of your eye down where your eyelid is and then instill a drop here. So maybe we can share a video of this in the next session, and that is important for you to know. So like again, like I said, pull this here, pull this down, and just instill a drop here. So you don't really need to rub your cornea or your white part of the eye called sclera. So avoid rubbing those. The next question from Ipshita is, what dietary guidelines should individuals follow to promote healing and recovery after cataract surgery? Okay, so good question, and it's a commonly asked question. We are often asked what dietary restrictions do we have. So, like I said before, there are no dietary restrictions. You can stick to your routine diet. Of course, anything that is healthy for your body is also good for your eye. But post cataract surgery, there are no specific dietary guidelines or dietary restrictions. You can eat whatever you want. So, any other questions? Okay, so the next question is from Aman, and the question is, are there any warning signs or symptoms that patients should be vigilant about post cataract surgery? So, a good question again. So, any surgery comes with a certain minimal risk that is involved, including cataract surgery. So there is a risk of infections, there is a risk of post-operative inflammation, which is why you should be aware of these warning signs. So if you have a sudden increase in the pain after cataract surgery, if you have a sudden increase in redness, discomfort, or if there is a deterioration in vision that is happening, then you should report immediately to your treating surgeon as soon as possible. So that all the possible potential complications of cataract surgery can be ruled out if you have any of these symptoms. The next question is from Seema, and that is, how important is it to attend follow-up appointments and what can patients expect during these visits? Okay, so goes without saying, it's extremely important to attend these follow-up appointments because there is a reason why they're advised. So there are a lot of things that we have to see after surgery. We need to see that the pressures are under control. We need to see that there is no inflammation in the eye, there is no infection in the eye, that the wound that is created during the surgery has healed well, the lens is exactly where we want it to be. So there are a lot of things that need to be looked at which is why it's extremely important that you come for your follow-up visits. The usual follow-up visits that I follow for most patients is at day 1 and at 2 weeks after that. In some cases where I want a sooner follow-up, I also ask the patients to come at 1 week. But this is essentially what I follow in most patients, and this is because I would like to look at the healing, the reaction that is there in the eye, if the lens is perfectly in place. So all of these things are important to look at, and extremely important if the pressures of the eye are not increased, because in some cases there can be an increase in pressures of the eye soon after surgery. There can also be an increase in pressures subsequently because of steroid eye drops that we give. So it's extremely important to evaluate all of these things on follow-up visits, which is why these visits are important. Okay, so the next question is from Deepika, and that is, can you offer tips for protecting the eyes from potential complications or infections in the weeks following cataract surgery? Great. So, yes, there are things that you can do. And in my opinion, the first week is extremely important, because within a week, the incisions, the entries that we make inside the eye now heal very well. So, it is unusual for an infection to enter the eye after 1 week. The manifestations of the infection can develop later, but if the organism is entering the eye, it is going to be most likely within the first week, which is why I do not want any dust or any water going into the eye in the first week. So these things are extremely important. So the precautions need to be taken for a week. After that, you can get back to your routine activities. You can start doing whatever you want. The next question is from Amandeep, and that is, what role do sunglasses play in the recovery process, and how should patients choose the right pair? Okay. So more than sunglasses, what is really important is to wear protective glasses. Whether these are sunglasses, as in their dark glasses, or their regular glasses, is not as important for us, because our purpose is that you should not be getting dust and water inside the eye. As far as sunglasses are concerned, or dark glasses are concerned, it makes you a little more comfortable soon after surgery, because you've had a cataract for a long time. There is not much light entering the eye when you have the cataract. So you're used to living in a slightly dull atmosphere, and the brightness that your eye has been perceiving for many years or many months is low. And then when the cataract surgery is done, you're suddenly able to perceive all that light. The brightness, the contrast of your vision improves quite a lot, and that can take some time for you to adapt. That is why if you wear sunglasses or dark protective glasses for a few days to a week, I think that's good enough, and that makes you more comfortable and prevents the entry of dust and infection from going into the eye. The next question is from Prajwal. Are there any specific sleeping positions that patients should adopt or avoid after cataract surgery? So again, a good question, and something we are commonly asked. There are no specific sleeping positions that you need to adopt. You can sleep in any position after cataract surgery. In rare cases where we inject an air bubble or something of that sort, the patients are specifically informed about this. So do ask your surgeon once, but in almost all cases, there is no restriction to which sleeping position you can adopt. The next question is from Surbhi. How soon can patients resume using electronic devices like computers and smartphones after cataract surgery? Again, a very good question and a very commonly asked question. So, the ideal time, in my opinion, is a week. And it's not that if you start sooner, it is going to harm your eye or the surgery will get a bad outcome. Nothing of that sort. It just takes you a little bit of time to adapt to the new optical system that you have now. So for you to get comfortable from the vision that you have after surgery takes a few days, which is why it's recommended to take it easy for the first week or so, and then start using your screen, start using your electronic devices after 1 week from the date of surgery. If you want to watch a little bit of TV, maybe 2 days, 3 days after surgery, that's fine. But near devices like laptops, like tablets, phones, I suggest that you start after about a week. The next question is from Sumandeep. Is there a recommended timeline for returning to work or regular daily activities after cataract surgery? Great. So again, a very important question. The answer here is also in about a week you can resume your regular activities. There are certain exceptions. There are people who we can allow the resumption of daily activities even sooner. There are also those who we need longer rests in, but those are exceptions. In most cases, within a week, you're good to start your routine activities. You can get back to work, you can get back to your routine life, and essentially, there are no restrictions after 1 week from the surgery. Okay. So the next important question from Himanshu is, what are the common mistakes or misconceptions that patients have often about post-operative care after cataract surgery? Okay. So again, good question. The Some of the misconceptions that are there are related to, say, that you can't eat something sour or you can't eat something sweet, things like that. Then some people also have this misconception that you should put gulab jal or things like that in your eyes. So it's important that you don't put anything in your eyes other than the drops that have been prescribed to you. As far as diet is concerned, you can have whatever you want. Like the another question that was asked was about posture, so that's again a common misconception that you cannot sleep sideways. So you can. All these things are not really something which is very important at this point of time. Very important to follow the instructions that are given to you, and stick to those. A lot of the other things are misconceptions, and some of them are based on the outdated concepts, based on the fact that surgery was done very differently maybe a decade back, and some of those things were applicable back in those days but not so much anymore. So I think that's all the questions that we will be taking. So thank you for joining us. I'll just sum up what we discussed. So cataract surgery, as we know now, is an extremely advanced procedure. It is quite comfortable. It is relatively painless, extremely fast visual recovery, and patients get back to routine activities very soon. There are some precautions that need to be taken, and how many ever precautions we talk about, the most important thing I will mention once again here is that you should not let dust and water enter the eyes for about a week after cataract surgery, and take a bath from below your chin level for about 1 week after the surgery. So these things ensure that the chances of any infection entering your eye are minimal, and that gives you the maximum safety in your post-operative care. So thank you for joining us for the live session. And if there is anything else that you feel that we should be talking about, or any doubts that you have, or any questions on this topic, please do mention that in the comments box that you'll see, and we'll be happy to address those.